You've written about how effective government regulation on tobacco has been in the past and implied that the next major hurdle would be America's diet. Since the 20th century, how
I
much
think the picture
progress do
is
you
very
think we've made
mixed.
in this
What I
direction?
take away from this is the challenge of advancing public health in an economic and political environment that privileges the pursuit of profits and free markets. Um, a lot of people can make a lot of money from selling unhealthy products that people like, unhealthy food products that have been very carefully engineered to be hyper palatable and to produce almost a kind of an addictive effect. People like these products. They are surrounded by them. The products are aggressively marketed. And this has really been one of the central challenges for public health in dealing with health problems related to diet and the food environment. And it's very challenging to intervene. And, we've seen some successes, some things like banning trans fats, artificial trans fats. That was kind of low-hanging fruit. I think other issues obviously are going to be much more complicated. Issues around the salt content of food, around the sugar content of food, partially because the science is less clear. There is more scientific uncertainty around the effects of diets that are high in salt and sugar and cholesterol, for example. One of the reasons that artificial trans fat ban was easier is because the science was very clear cut on that, and it was a sort of an extreme case to take that out of the food supply. It's much more complicated to think about how you reduce levels of salt and sugar and the targets of what those reductions should be are much less clear in the science. And there's much greater pushback because many, many more people make a lot more money off of products that are high in salt and high in sugar. So, I think that there's been some effective action, often at the local level, which is where you often find public health intervention around things like sugar-sweetened beverages, but pushback from the industry on that has been enormous. There's been some successful action around calorie labeling on menus in order to help people to make better dietary choices, but there's also been pushback from the restaurant industry on that. So, I think we've seen some small incremental progress on the issue of food, in particular. Some kind of moderately good news. Rates of obesity among children seem to have plateaued, but there's still a lot more to do. As long as we live in a kind of a political environment that privileges free markets, I think that will be a challenge. I mean, to go back to the issue of e-cigarettes, there's a very good example of that from some litigation that happened. I think it was in Michigan. There was a lawsuit challenging Michigan's ban on the sale of vaping products to youth, and one of the makers of the e-cigarettes, I don't remember if it was Juul or one of the other manufacturers, sued that this was an infringement on their rights, and basically the judge in that case held that the right of the company to make a profit off of their vaping device was a greater interest than protecting the health of youth. And so as long as we live in an environment where that kind of ruling can happen, I think that will be a challenge for public health.
One of the most obvious negative reactions to this restrictive legislation is that people feel the government impinging on their freedom of choice. What role do you think the government should play in
Yeah.
restricting what
Yeah, I
someone
mean, I
does
think
to
we
their
need to
own
remember
bodies?
that the the environment we live in of our choices has been structured for us. The world that we move through, the commercial environment that we move through, isn't completely natural. It's created by humans, many of them humans with, in order to make profits. And people don't live in a world of unlimited free choice. Our choices are constrained all the time by all sorts of factors, by the zip code that we were born in, by who our parents are, the environment that we grew up in. There's an old joke about how the rich and the poor are equally free to buy Cadillacs. Like, nobody's saying you can't buy a Cadillac if you're poor, but in fact, the rich have many more choices than the poor. Life structures our choices all the time, and I don't think it's inappropriate for government to step in and to structure those choices in a way that foster equity and improve health outcomes. I mean, we are the government. We are the government of the people. We have mechanisms of accountability. If you don't like the policies enacted by your elected representatives, you can vote them out of office. That's the way it works in principle, at least. Obviously, not always in practice. But Abraham Lincoln said, the government is ourselves organized. And so I think we can agree that we want to foster a certain kind of society, a more healthy society, and we can come together to structure choices in a certain way. I think this narrative that, people have unlimited free choices and here's the government come to restrict our choices is really a false narrative, because it overstates the extent to which people have these sort of unlimited choices in life. Our choices are structured all the time by things outside of our control.
All right. So moving on, I think a lot of your work and what we've talked about so far has been centered around this idea that public health isn't a purely scientific endeavor. Could you just just touch on what other factors might influence these policies maybe put into place?
So public health absolutely is science-based. What I argue in my work and what my colleagues and I believe is that it can't only be science-based, and that there are many dimensions of public health that can't be answered solely by data. We have to have scientific data to inform our choices, but many questions in public health involve questions of values. So I think probably the most obvious example of that is the effect of socioeconomic status on health outcomes. Right? So there is a mountain of data showing that people do better, have better health the higher up you go on the socioeconomic ladder. And that unequal societies, the more concentrations of wealth you have in fewer hands, have worse health outcomes overall, and that extends all along the gradient. So the super wealthy have better health outcomes than the merely wealthy. The extremely poor have worse health outcomes than the moderately poor. And that really raises a question of what we as a society value, and do we want to foster the goal of a just and equitable society in order to improve health? That's not an empirical question. That is a question of values. Do you want to have an equitable society? Do you want to have a society that is a just society where people have equality of opportunity? In our society today, we absolutely do not have equality of opportunity. We don't have equality of health opportunity. The biggest determinant of your health status is the zip code that you were born in. And if you were born in a zip code with a great deal of poverty, that is going to determine a lot of your prospects in life and your health outcomes. And I think that raises really profound issues of justice and fairness. And I think many people argue, and I agree, that there's something very very morally, very ethically wrong about an unjust society? Again, that's not a scientific question. I think the science helps us understand the dimensions of that problem. We need the science to know, to guide us and to tell us what steps are going to produce what outcomes. But the question of whether or not we want to live in a just society, whether we want to live in an equitable society, that's not a scientific question. That's a question of value. So I think that's this issue of the distribution of wealth and resources in a society and its effect on health, I think is the most obvious example of a question that's not really a scientific question. There are other realms of public health where I think values are implicated. Health is a value. Good health is a value. I think most people would agree that it is of some value, but it's not the only value that people have. People hold other values that they may choose to prioritize over health. Health outcomes are sometimes in conflict, or at least in tension, with cultural values around gender relations, around sort of power relations within people. Health may be in conflict at times with religious values or religious practices, and in deciding whether and how we are going to promote health, we have to come to a judgment about how much we value health vis-a-vis these other values that we hold.
This is just like a sort of wrap-up question looking to the future. If you could paint like the 20th century in one big brushstroke, what do you think like the most important lesson we can take from like that century of public policy going into the future?
Boy, one lesson out of the 20th century. Gosh, there are so many things we could learn from the 20th century. So the most significant source of sickness and death across the entire 20th century, the thing that was responsible for more sickness and death than anything else across the 20th century, was the cigarette. And I think that is a kind of a classic example of what I talked about earlier, of the potentially negative effects of so-called free markets and the pursuit of profit on human health. Many people continued to make a lot of money and grow very wealthy off of selling cigarettes long after it was known that cigarettes are deadly as used. And to this day, the cigarette is the leading cause of preventable sickness and death in the world. And there's a great book about this, or several great books about this, but there's a book called The Cigarette Century by Alan Brandt, a historian at Harvard, who wrote about the kind of the trajectory. One reason I think of it is because it maps so neatly chronologically onto the 20th century. The cigarette really rose at the beginning of the 20th century and seemed to be on the decline at the end, although it's still very much with us. And I think it encapsulates many of the challenges that we face in public health. That the cigarette was a source of pleasure and status for many people, at the same time that it was a source of horrible sickness and death, and people were able to make a profit off of it. Of a colleague at Mailman, a historian, who has his favorite saying is, "We build the worlds that kill us," which sort of sounds like a pessimistic thing to say, but I guess the flip side of that is, if we build these worlds, we can also make worlds that don't kill us. We can make worlds that foster health, and we simply have to decide as a society what kind of world we want to make. And the cigarette example, I think, is a good example of that. This was an entirely human-created epidemic. The epidemic of tobacco-related sickness and death was entirely created by people who wanted to make money off of this product. It didn't have to happen that way. And so if we can create epidemics like that, we can also create worlds that foster health and human thriving for all of us. But we have to have the will, the political will to make that happen.